If you see you have 100, 200, 300, or whatever, please support the surgery of these children.
50-year-old Anna Katuregye is doing the unconventional. She has for the last 5 years taken to streets to beg, accompanied by some of the ailing children she looks after.
Thank you. Thank you very much. May God bless you. Thank you very much.
Katuregye's method may raise questions in some quarters, but he says she has been able to assist at least 70 children and nurse them back to health. Characteristic of these children is the swelling on their faces. A consultant at the Uganda Cancer Institute, Dr. Henry Ddungu, describes this condition as Burkitt's lymphoma.
The commonest that we see among children, especially between the ages of 4 and 11 years, is a kind of cancer that was first described way back in 1956 by a British surgeon by the names of Burkitt, Dennis Burkitt. He was actually working in Uganda by that time.
But what exactly causes Burkitt's lymphoma?
The cause may not be known for sure, but the current understanding is that it's an infection-related cancer. And the infection here is a virus that we call Epstein-Barr virus. This virus is known to help certain cells that we call B cells. These are cells that help us to make the immune system.
Because of the way it presents itself in patients, it's often easy to tell when something is wrong.
Usually when you get a swelling in the neck, the most likely cause is either a soft tissue that has been infiltrated by disease, or it could be the lymphatic system. Usually we talk about lymph glands, and they start swelling like this, especially if they're not painful.
We found some adults with Burkitt's lymphoma at Esezza Foundation, but this fast-growing tumor is found mostly in children.
It's actually known to be one of the most aggressive cancers in the world because it multiplies rapidly. A child who had a small swelling 2 days ago, by the time they come to you a few days later, it has doubled.
These tumors either attack the nose, neck, mouth, or any part around the head.
There are so many lymphatic systems around the head and neck, and I think that's why it loves that area. But it can also form in the abdomen.
There are many types of Burkitt's lymphoma that include an endemic variant, which is common in children living in malaria-prone regions.
We have also observed that many of the children with Burkitt's lymphoma tend to come from the eastern part of Uganda, and then those other areas of eastern Uganda. There could also be, again as I said, you might find that a lot of infection might be around that area, but there could also be other factors.
Ddungu describes Burkitt's lymphoma as one of the most dangerous cancers in children, but says some of the tumors diagnosed are non-cancerous. Katuregye has for years been begging on the streets to raise money to treat children with Burkitt's lymphoma. Dr. Ddungu, however, says there is free treatment for their condition at the Cancer Institute in Mulago.
At the Uganda Cancer Institute, we treat all our patients at no cost.
There is no vaccine against this type of cancer yet, but the Uganda Cancer Institute is currently conducting research in this area. Agnes Nandutu, NTV, Kampala.